Hi everyone, welcome back to the Beauty Triangles in Clinic series. We are at the newly opened, completely beautiful art clinic in Belgravia with medical director and founder Dr Priya Verma. A very big thank you for having us in, Priya.
Thank you so much for being here. It's really lovely to have this conversation with you.
No, I'm absolutely delighted to be here, and we're going to very much be talking about the power of post-procedure skincare, touching on a range that you're now using, Epicutis, as well as a lot of the new treatments and technologies that you're integrating into the patient journey. But before we take a deep dive into post-procedure skincare, I'd love to sort of touch on just skin as a subject matter, because this is your raison d'etre. Everything that you do is about enhancing, optimizing your patient's skin. But what is it that most of us are concerned about, and why is skin such a focus for all of us?
So I think the rhetoric really changed a few years ago when we've been less focused on symmetry and wrinkles and, structural issues with the face. And now people are really focusing in on optimizing skin quality. Agreed. So they're coming in and they're talking about how, I just want my skin to be healthier. They're using these operative words that we weren't really hearing a lot of, even a decade ago. So now it's more about how can I improve the longevity of my skin? I know that I probably should be doing something preventative. So what is that something preventative? And so what we're focusing on in the clinic now is these regenerative treatments that are actually improving the health and function of the skin cell. Because when you do that, you actually get more out of the treatments, you get more out of your sort of aesthetic, instead of chasing symmetry and trying to get facial balance. It's just,
so true.
Let's really kind of embrace our unique individual features, but just have really healthy skin.
It's like it all starts with healthy skin, right? Unless you get that sort of absolutely nailed, then you can't go on to do all of the other things that might be enhancing and tweaking and refining and preventing, and sort of going down that longevity route. That's really interesting. And I think we're seeing more sort of concern around texture coming up, more concerns around luminosity, around glow.
Definitely.
What are the sort of key areas that patients seem to be saying to you, I'm struggling with this when it comes to my skin and I don't quite know where to go from here?
So some of the key things or key concerns that patients come in with is, I feel like my skin's a bit lackluster, it's starting to look really dull, I just want that little bit of radiance, I want my skin to glow, and not just when I'm wearing makeup. And I think also,
that's so key, isn't it?
Yeah, we've come into this era where we're trying to minimise the use of makeup, and we're really just trying to let the skin breathe and allow it to kind of, we're trying to embellish its unique features. And so it's absolutely about evening out the skin tone. So when we're starting in our sort of late 30s, early 40s, noticing signs of pigmentation, which is essentially stresses on the skin. So there's environmental UV stresses that start to surface in our 40s. And we start to notice those changes that patients then say, okay, what can I do about this before it gets worse?
Yeah,
so
exactly.
Then we kick into a conversation about preventing UV damage, and also trying to think about things that are going to softly even out the skin tone. The other thing that I notice is people are really focused on gels and laxity and skin sagging.
Yeah.
And so this is something that I do a lot of. I do a lot of skin tightening, but they'll come in and they'll say, I've just noticed a few millimetres of change. My skin is just starting to dip forward, or
Does everyone come in and do this?
They
I just
do.
Want to look like this.
Absolutely.
We all pick
the
up the
two-finger salute. And, and so they'll come in and they'll say, look, if there's something I can do now, I'd rather do that than do something more invasive that's a little bit more involved, just a couple of years down the line. So absolutely, I think people are really embracing prevention. If there are micro changes we can start manifesting in the skin, why not do those?
Agreed.
And so that's when we kind of think about changing the repertoire of treatments. And that's exactly what we've done at our clinic, is think about, taking that patient on a journey from the very early concerns right through to dealing with tightening up the skin. And
I like that you call it a journey, and I think sometimes we forget that, something bothers us about our skin and we sort of try and throw everything, including the kitchen sink, at it to try and fix it. But actually we do have to remember skin is a living, breathing organ, and we need to give it time to react, and we need to go on that journey with it. And I think that's where the whole trend around post-procedure skincare is so interesting, because it really makes the patient a part of that journey. There's so much that you can do in clinic as a brilliant practitioner, but as the patient, I need to go home and I need to be using the right skincare and the right ingredients to enhance the effects of what you've done. I mean, are you seeing post-procedure becoming more of a trend now in the world of skincare?
Absolutely. It's something that we've been saying for such a long time, which is, yes, you can come in for a treatment. And I say this at every consultation. You can come in, you can have in-clinic treatments, but what you do every single day consistently at home is going to supercharge your results. It's also the difference between seeing a good result or seeing a great result.
Yes.
And so when patients understand that and they commit to going on a journey, then you'll find that compliance is better, but also because they have the know-how, but also their results tend to be better. So I talk about skincare as a non-negotiable, but it's really important not to overcomplicate it, because many times patients will come in, they'll say, look, I'm doing lots of skincare, I'm using lots of antioxidants.
And then they reel off a list of like 16 different things.
Absolutely.
And you're like, this is just scrap it all.
Well, exactly. And I always say, well, there's just no point in you having a 10-step routine where you're chopping and changing ingredients week on week. You may as well just have 3 hero products that you use consistently for months on end and try to get the most out of those products. But post-procedure skincare and just post-procedure care in general of the skin, I wouldn't even say it's a trend. It's almost like it's become a necessity to, I suppose, communicate to patients. It's something that we've been saying all along, but I think patients are really buying into the notion of looking after the skin.
It's definitely become more of a concept, hasn't it? And now patients are like, oh, post-procedure, and it sounds really snappy. But I suppose, to your point, you've probably always been doing this. You know, you would never have done some, I don't know, microneedling or a laser and then just sent people home and been like, see ya. Like, you know, see how it all goes. Like, you would always have followed up with which skincare are you using, but now we've defined it a bit more.
Definitely that. I think now we also as practitioners have a little bit more steer, because there's more, you know, clinical data coming through of what is good for the skin after you've just wounded it or thermally or mechanically injured it.
Because it is all about that sort of micro trauma, isn't it? We can't get away from that. That's how the skin is healing, regenerating, it's sort of optimizing itself. But then it's knowing, and actually I'll be interested to get your take on it, the exact ingredients that we need to be using, or what type of ingredients we need to be using that can really help to spur that recovery and accelerate the healing, so that we don't have the discomfort as well, because that's the other thing, you know, too much downtime, too much sort of pain and suffering after a treatment, and no one will come back. And
well, that's it. So I think, you know, in order to ensure that patients want to continue with this, what is a long game in looking after the skin, you do have to ensure patient comfort. So you're absolutely right. You'll come in, you'll have some microneedling, particularly if you're going to have medical microneedling, where you're going to specific depths bespoke to the skin that you have in front of you in order to trigger erythema, which is essentially redness of the skin, but also in some cases pinpoint bleeding, in order to actually get sufficient amount of wound healing and wound repair that then boosts collagen, wakes up your fibroblast cells. When you do a medical microneedling treatment, just as an example, your skin is uncomfortable. I mean, you will feel quite red,
fiery.
hot. Yes, it does. And, you know, it's about how can we make that commute home for the patient a lot more comfortable. But also, we have a golden opportunity. And it's thinking about when those microchannels have been created in the skin, do we have now a really great opportunity just to infuse the skin?
Like feed the skin.
Exactly,
like
with a powerful ingredient. And so when you say, you know, what sort of ingredients should we be looking at? There's certainly things we can be using pre-procedure, and that all requires sort of careful thought and consideration based on the patient's unique needs. So it may be anti-inflammatory ingredients, peptide technology, but also maintaining the skin barrier. So if you do have a compromised skin barrier, so where your skin might be feeling a little bit irritated, dry, itchy, red, it's about making sure that prior to wounding the skin anymore, that we really repair that.
So you're getting it into a nice, calm, steady state before throwing more at it.
Definitely. And so the mainstay of kind of skin barrier treatment would be fatty acids, lipids, ceramides, those sort of ingredients that really lock moisture into the skin, but also things like hyaluronic acid to just prevent that sort of transepidermal water loss that we get sometimes when the skin isn't really looked after very well. And actually I see this a lot when patients come in, they're really proud of themselves. They say, look, I've been doing vitamin A, vitamin C, I've been using lots of antioxidant serums, I'm doing the works, but actually that's sometimes too much for a patient.
I think the skin barrier sometimes that it's definitely coming under too much pressure when you're throwing everything at it in that sense.
Exactly. And then it's the decision, you know, the joint decision that we make about, okay, is now a good time to actually throw more inflammation at your skin, or should we just peel it back a little bit? And so often I'm taking patients off actives, calming the skin down, really repairing that barrier, and then scheduling a treatment in clinic to really restart that whole wound instigating a wound into the skin, just knowing that it can tolerate it well.
That's really interesting, actually, because it's actually showing us it's not just about the emphasis on the post-procedure, it's pre and what we're doing in terms of that entire journey.
Yes.
So if pre-procedure is all about strengthening the skin barrier, ensuring that the water sort of content of the skin is really amplified and everything is in a nice, healthy, supple sort of state, what is it that we're looking for after the treatment in terms of the post-procedure care? What's going to soothe the skin and heal it and get it sort of turning over and repairing as we want it to?
So post-procedure, it follows very much a similar premise in that you've just now created lots of injuries in the surface of the skin. And so going back to this sort of golden opportunity of putting something inside the skin, it's about ensuring that we get adequate wound healing. But we're also taking the opportunity to lock in an ingredient that will further regenerate the skin. So the sort of things that I've been exploring are the Epicutis range, which is wonderful because it's really focusing on clean ingredients, ingredients that are non-toxic, incredibly safe. And I must add that this range, the reason why it really caught my attention is because it's safe in not only all skin types, but almost every moment of your life, whether you're pregnant, breastfeeding, having rosacea, acne, it's suitable for you.
That's incredible. I don't think I realised actually the sort of diversity that it could help treat as well.
And it's because they're really just working with simplified ingredients.
Yeah, it makes perfect sense.
Yeah, and they've done so many clinical studies looking at the optimum concentrations of these key ingredients. So then you're not worrying about having lots of buffers and additives into the product because you're really just letting the ingredient work and do its job.
And I suppose sometimes it's those buffers and those additional things that are causing the sensitivity, even if you've got incredible gold standard sort of key ingredients in there, it's everything else sort of around the edges that sometimes is causing the irritation or the inflammation that you don't want. It's such a beautiful range as well, I have to say. I spotted it sort of behind you, and it's very now, very clean, very clinical, very beautiful. It fits in very nicely with the clinic here as well. What are the key products from the Epicutis range then that you're sort of relying on or that you're introducing to your patients to now help them manage that sort of recovery from the treatments you're doing? So
the products that I've fallen in love with, I have to say, is the mask. So they've got this amazing...
The sheet mask.
The sheet mask.
Yeah,
it's a
they're incredible.
Lipid repair mask, and it's great because it's infused with a really quite a high concentration of TSC, which is an abbreviation for a very, very long word.
I'll be really impressed if you get it right.
Which I can certainly try to get it right for you, but it's tetramethyl hexadecinol succinyl cysteine.
Oh my goodness, that was so impressive.
Which I don't say in consultation every single day. But essentially, TSC is a lipid-like molecule. And what it's doing is it's working really hard to repair the skin barrier. So you can see why it's my product of choice post non-ablative laser, where there's been microthermal injury into the skin, but also microneedling, where we've mechanically wounded the skin.
And it also has like an antibacterial quality, doesn't it? So I guess, again, when you've done those very medical grade treatments, you need to ensure that there's zero chance of infection, inflammation afterwards.
Oh, totally, because there are studies that are showing that it actually reduces the acne-causing bacteria.
That's interesting.
Corynebacterium acnes, and it's wonderful to see that in one product you've got reducing inflammation, barrier repair, antibacterial properties, but not just that, it's one of those biocellulose sheet masks that you can actually apply to the skin and pop your patient under a medical grade LED.
Oh, that's really nice. I love the idea of stacking all of these things on top of one another. So as soon as you've had the medical grade microneedling, as an example, the sheet mask is safe to go straight on the skin afterwards, and I'm sure that's so soothing and calming. I was just
about to say, it's really calming, and patients are so thankful. They lie there and they think, I've had microneedling before, but I've never had, a mask applied onto the skin. It does feel incredibly soothing. It takes a lot of the heat out of the skin. Yeah. So, if you have had a medical microneedling treatment, which is quite deep, you've got to pinpoint bleeding, the skin gets quite angry. Definitely. It gets quite hot. It has this slight burning sensation. It really just takes that all away. But the other thing we can do is, once we've removed the sheet mask, we tend to put it on for about 10 to 15 minutes. Then we can apply the lipid recovery serum, which again also has TSC in it, but it's also just one of those enriching products that remains on the skin as the patient is going.
And I suppose it sort of creates that almost seal and like a sort of barrier perhaps that makes the patient feel then very safe about, you know, you've obviously just had lots of little microneedles driven into the skin, and you know there's been some trauma, and then the last thing you want to do is feel like everything is exposed.
Exactly.
So nice to feel that it's probably sort of more comfortable and everything's locked in.
That's it. That's exactly the terminology I use. It's sort of locking in all of that great work that we've done, just taking that inflammation down just a touch, not too much. We obviously want inflammation when we're doing these treatments. That's the whole point of it. But it's about ensuring that the barrier isn't too inflamed that it's going to break down in the coming days.
And there's another ingredient, and I think I'm saying this correctly, Hivia, which is all about, again, amplifying hydration, supporting sort of the comfort of the skin as well. That comes into the Epicutis range, doesn't it?
It does. It's actually their moisturiser.
Okay,
so they've got a really simplified routine. It's really nice for patients who aren't au fait with kind of multi-step routines. They just want something that's sustainable, something that's consistent, they can do every day.
Fits into life.
Absolutely. You've got a sort of a cleanser, you've got your lipid recovery serum, and then you've got the Hivia moisturiser cream. Now, the Hivia cream is actually made with a patented chia seed oil extract.
Interesting.
Which is rich in omega-3 and omega-6 fatty acids.
Yes, exactly. So again, really supple sort of making for the skin.
Exactly, and you can just tell that when you're using those sorts of ingredients, it's really going to lock in moisture.
Yeah.
I think there was a study done where they were going head to head with another moisturiser, and essentially it shows that the retention of moisture within the skin is a lot more longer lasting, up to 24 hours of moisturising capability with the Hivia cream.
Which is interesting given what you were saying earlier about the transepidermal water loss as well, and how key that is, and sort of maintaining that so that the skin doesn't again sort of break down and become sort of too angry and inflamed.
That's it, and so that's why I always say, if there is an option to have something that gives you long-lasting hydration, particularly in this busy world, everybody is coming in, just about making time for in-clinic procedures, and they have to get back to work, and it's really tough for them to kind of have to keep applying something regularly every few hours. So if you have something that's longer lasting, it certainly is more efficient for patients in terms of their recovery.
I think sort of how comfortable patients feel using these products is really key. I love the concept of the sheet mask as well, because you can get the whole packet of them, right? And then you've got that touch-free sort of, it feels much cleaner experience of just cooling the skin instantly. So again, I think thinking about how consumers and patients even use these products is really, really important.
I think sheet masks are really on the up. I mean, patients will say to me, thank you so much for putting a sheet mask on my plan, because it's one of those Friday night rituals now.
Yeah, exactly.
I'll go home, I'll cleanse my skin as soon as I get in. It's just nice to take your makeup off, but then I may just lie there and just, reflect on the week and lie there with a sheet mask on. And it's a really lovely thing.
That sounds so nice. I need to go home and do that.
Yeah, exactly. It was an idea a patient of mine gave me, and I just thought, the way we think about skincare needs to just be reframed slightly. Instead of it being a laborious task, why don't we think about it as a self-care ritual?
Exactly.
It's 10 minutes of your day, whether it's, you've newly had a baby, take that 10 minutes to just go into another room, cleanse your skin, apply some nice products, and really feel like that was a moment for yourself. And I think it's
That's
nice.
what self-care is for some of us, isn't it?
Is.
Just that sort of 10-minute window. That's all you're going to get with children.
Exactly.
I know that now. We've spoken a lot about medical grade microneedling as an example of where you might be using these, but what are the other treatments whereby you might say a sheet mask is now sort of what you want to be using, or the Hivia cream, the moisturiser, might also sort of complement it, or the lipid serum? What else would you be doing?
Well, if you think about it as, this being an option, these recovery sheet masks being an option for any opportunity where you have just inflamed or wounded the skin. So, for example, microneedling, non-ablative laser, but also ablative lasers. Yeah,
absolutely.
So, we've got in-clinic treatments where you are quite literally vaporising the top layer of your skin. You're removing those keratinocytes that are sitting on the top surface of the skin, and that leaves you with a slightly exposed barrier, right? Yeah. Because you've just stripped away that protective layer of dead skin cells. Yeah. And so for ablative procedures that usually incorporate CO2, erbium, YAG, ultra clear, those sorts of treatments, I would say this is an absolute must. It's a really nice opportunity to lock in hydration.
Yeah, at a time when you're feeling quite vulnerable and the skin is feeling quite raw.
Exactly, and specifically with its antimicrobial properties as well. I think it's a great opportunity to kind of ensure that you're sending your patient home with that just another layer of safety in their skin.
What about things like the injectables or endolift? You do a lot of endolift, don't you? I mean, where do these sort of more specialised treatments come in terms of the skincare and what's needed?
What I would say is that any time you're putting heat into the skin, and with endolift we use this little wire, it tunnels under the skin, we deliver heat quite deep.
Most of those gels that we were discussing earlier.
For that skin tightening in the jawline. And it's great, although we are keeping the skin barrier intact when we do endolift. So what I would say is something like this, the Epicutis range, is great to just take down the heat.
Yeah.
Because there is a degree of inflammation, there's a bit of swelling, there's also just that low-level inflammation that's happened on the surface of the skin just from manual manipulation of the skin. With regards to injectables, again, when we're using biostimulators, we're creating a little bit of erythema on the surface of the skin, and it's nice just to be able to lie your patient down for 10 minutes after what was probably a slightly uncomfortable treatment, and just feel like you're a little bit more comfortable before you leave the clinic. So I think as practitioners, if we really think about the patient journey, there's so much we can do to optimise their experience.
There's so much more focus now. I do agree on the experience, on I think, we used to sort of exist in an era which was, no pain, no gain when it came to these treatments. And it's nice now that practitioners are really on the front foot when it comes to finding a way to mitigate the pain so that we get more of the gain.
For sure.
I loved what you said earlier about sort of layering it with the LED as well. This is something that you're obviously doing a lot of in clinic. Maybe we can take a step back and just discuss sort of LED as a concept. What is LED and why does it sort of have a role to play then when it comes to optimising the results of these treatments?
So LED stands for light emitting diode, and essentially it's a non-invasive treatment that uses lots of different wavelengths of light, and they are creating a biological change or triggering a cellular process in the skin. And it's also known as photobiomodulation. So if you, I don't know if you've dabbled in a bit of Latin, but photons of light, so it's utilising light energy to create or modulate the skin's biology. And so you've got different wavelengths, and so different companies, different brands will utilise different wavelengths. Now I use the Medilux LED, which is a medical grade LED system, and it's been a real game changer for us in the clinic because we're quite literally sending everybody upstairs into our wellness room after any procedure. If I see a spot of rosacea, I'll say, go and sit under the LED and go and have your green and yellow combination. If we see somebody who's got acne-prone skin, they're really struggling with it and having lots of breakouts, we'll say, why don't you pop upstairs and try a little bit of blue light LED.
Because it has 5 different wavelengths?
Yes. So it's quite unique because it does have 5 different wavelengths of light, and I'll list them off, but essentially it's blue light, which is really helpful for kind of reducing those sort of the bacterial load in acne-prone skin types, but also green light and yellow light, which I find is really great for reducing inflammation and particularly useful in rosacea and skin redness prone types.
That is interesting, and I feel like you hear less about green and yellow light. You hear a lot about red light, you hear a lot about blue light, but these obviously also have a role to play. And rosacea and the underlying redness, that's a real, well, particularly when we're sort of talking about the trauma and the micro trauma that we've created, or even if it's just someone's skin, the redness can be a real cause for concern.
It can make patients very quickly uncomfortable with gentle stimulation in the clinic. And so it's nice to be able to have a bespoke protocol that for a patient who is struggling with active rosacea, yes, we can still do treatments and we can, needle wound to the skin, whether it's injectables or microneedling, but then we can mitigate that inflammation and just calm the skin down. Now, what I like to do is actually prime the skin, and I use a lot of LED prior to treatment.
Okay.
Particularly microneedling, because there is, this premise that when you're microneedling the skin, you're wounding the skin, but that's an intentional wound that you've created. So actually what we do is we send patients upstairs for a priming step. So have your LED first.
Okay,
and we do that a lot with our facials as well. If you're doing a gentle resurfacing facial, it's better to do your LED after a deep cleanse. And then allow the inflammation to actually take shape and get that collagenesis happening, but then utilising medical grade skincare like the Epicutis post-procedure for that cooling effect. And so, the Medilux, so out of the 5 different wavelengths, we've got the blue, we've got green, yellow, we've got the red that I think everybody knows a lot about, which is collagen boosting.
Collagen stimulating.
Exactly, and then you've got near infrared as well, which is great for wound healing. And so it penetrates us that little bit deeper, and it allows patients who are perhaps post-procedure having a lot of inflammation or having a slightly more redness response, then we can, or if they've had a bruise, for example, we can send them up and have some near-infrared LED.
It sounds like you're making it incredibly bespoke, which is really nice, because I think, again, patients have got to that stage where they don't want to feel that the treatment you're prescribing is like a one-size-fits-all and everyone's doing it. You know, we all want to feel that this has been tailored to me, these are my skincare concerns, this is the treatment that I've just had, and this is the package that you've curated almost as that you sort of orchestra sort of director of everything to get their skin back into good shape. And interesting as well, because I think the Medilux device has all of the, you can use it on different areas of the face and the body, can't you? Yeah. So I think so often when we talk about the skin, we think we're just talking about the face, and we forget, you know, it's the neck, it's the décolleté, it could be the back, it can be all areas of the body where we're sort of feeling under fire.
Yeah, I mean, that's the one great thing about I mean, there's lots of great things about the Medilux, but the fact that it's got this articulated arm, which it has lots of different panels, you know, we can flatten them, we can rotate them, we can customize them to your face shape, we can put them on the body, we can use them when I'm doing treatments with endolift, for example, we do inner thighs, or we're doing the buttocks. You know, we can actually put someone under an LED just before they're about to have a lymphatic drainage massage, you know, because that tends to be a pairing that we offer in the clinic. And
that's interesting. So before lymphatic drainage, you would be using LED as well?
Yes, we do that quite routinely. So almost
how does that sort of, what's the synergy there between the lymphatic drainage and the LED? Yeah.
So when you've just triggered lots of inflammation in the skin, and you've also, when we just put some tumescent anaesthesia in, you may have just with your cannula, you may have created some bruising, and the body areas tend to bruise quite a bit. What we find is that lymphatic drainage is really, really useful for getting rid of a lot of the tumescent anaesthesia.
Absolutely, yeah.
So what you want to do is, especially if we're doing fat reduction treatments, so we go in with our laser, deliver a bit of heat, it melts open fat cells, triggers a bit of collagen stimulation, so you're getting skin tightening, fat reduction, but you have got perhaps a bit of bruising. Probably got a bit of swelling from liquid that's been placed into your skin just for comfort. So then we send patients upstairs to our wellness suite, and essentially there what we're doing is we prime the skin so when we put them under LED, what we're doing is using red, near infrared to help with the bruising, but also to improve collagen boosting. When we've just done an endolift, for example, we're trying to boost collagen, why not try and do that in a sort of supercharged way?
Yeah, exactly. So, I love the idea of this. I need to come and book in for all of this, by the way.
Of course, you're welcome
offline.
Anytime. And essentially the LED just helps to really calm and regulate the skin. Then the therapist will do a manual lymphatic drainage massage, because what you're doing is you're activating those lymph channels, clearing away any toxin, clearing away the liquid anaesthetic, but also helping to direct those melted fat cells into the lymphatic system, so that we can get a speedier clearance, and the patients won't have as much swelling or downtime.
It's so genius, and it's such a sort of thoughtful way of curating that journey. Is LED safe? Is it suitable for everyone? I mean, there's been a lot of confusion, I suppose, of late as well with the sort of at-home LED devices and where they fit in. But what's your take on it? I mean, suitable for most people who will come to see you.
I would say it's probably one of the safest treatments we have in our aesthetic repertoire. It's safe for all skin types, not just skin types in terms of Fitzpatrick skin colour and skin tone, but what I would say is it's safe even for the most sensitive skin. So whether you've got rosacea, or you've got an underlying skin redness, or you're currently having active acne.
Or sort of active acne, yes. All these things where people otherwise say,
get weary.
Steer clear of this treatment whilst it's active or whilst it's flaring or whatever. And actually at those key moments are often when patients are really, really in need of these treatments or these technologies.
And I wouldn't even stop there, you know. I've even seen it's been so useful in patients who suffer with psoriasis. I suffer with psoriasis.
Really?
You know, eczema-prone skin types, when you're having an atopic dermatitis flare, anything like that. It can be so useful. And I think having an LED in the clinic which is suitable for face and body, you'd be surprised at how many patients come in, they've got sort of awkward areas of the face and body that may be really helped by using LED. And so you can use a medical grade LED like Medilux as a standalone treatment. So pop in, you know, every couple of days for 20 minutes at a time.
What does a course look like? How many sessions would you be advising for somebody perhaps with psoriasis, for example, or eczema?
So this is something we're actually doing some case studies on. So there'll be more on this soon, but essentially we're trying to work out, you know, exactly that. What is the target number? And so if we're starting at 4 to 6 sessions, we know that having a weekly session of medical grade LED is going to be effective and it's great as a maintenance.
Yeah.
But when you've got these specific medical, dermatological concerns, then we have to be slightly more bespoke. And so I think we're probably starting patients on about 4 to 6 sessions of standalone LED therapy in order to really judge it on its own merit, without doing any other treatments, without incorporating new
you have to.
medical prescription strength skincare, to really understand, what is the capability of these LEDs for dermatological conditions.
It sounds like it must be such a rewarding experience for the patient, to go on that journey as well, because I mean, a lot of the things you've mentioned, rosacea, active acne, psoriasis, eczema, these are things that often there is no finish line in sight for a patient. And like we previously discussed, there's not always a treatment that the practitioner wants to sort of recommend. So it's really nice to have something like a Medilux, course of treatment where the patient feels that they can actually do something proactive for the skin, condition, even if there is no treatment as such. It's an ongoing sort of protocol that hopefully makes them feel more confident, more comfortable in their skin. I mean, you must have seen some amazing case studies with patients or experiences where people have actually come away and said, this has really fundamentally made a difference, like quite profoundly, to how I feel about my skin as a result of these these treatments.
I think it's also just testament to the way Medilux has been formulated and put together, because you've got these singular wavelengths that are being administered onto the skin. And what you'll find is that with some other brands, whilst they are excellent machines as well, they're utilising different wavelengths simultaneously. And so what you'll find is that you're diluting power down when you're having to use multiple wavelengths at the same time. So with Medilux, the reason why it is so effective for these conditions such as eczema, psoriasis, is because you're using standalone wavelengths for a set amount of time, for a set number of minutes, at a much higher energy output. And so I think what's really been noticeable for us is when you've got a rosacea prone skin who comes in for a treatment where they want to boost collagen, they want to future-proof their skin, but they're very weary of the fact that they're going to be red and look like a tomato for a lot longer than most other people.
Exactly, or they don't even want to take that next step into the sort of preventative journey because the rosacea is still their sort of key concern.
It's been so lovely to watch kind of the combination of Medilux but also Epicutis really calming that inflammation, making patients feel confident to come back for a second session.
Yeah, exactly. It almost opens the doors to any patient, no matter what their skin history is, no matter what the present sort of situation is with flare-up sensitivity, compromised barriers, you name it, to sort of feel like they're doing something proactive and positive for their skin.
Definitely. I think that's been the most rewarding thing to see, is that, patients feel like there is something for them on the treatment menu. Yeah.
No, it sounds like such a fantastic sort of combination. I sort of keep saying curated, but I sort of feel like in the art clinic, it's really about that. It is about sort of curating that journey for the patient and using the right technologies, the right treatments, the right topical ingredients, and sort of, I suppose formulating that very bespoke package for the patient that they feel is sort of really truly theirs and fits their skincare concerns.
Exactly.
I said this to you offline, but as soon as I'm back, I'm fully here and on this treatment bed. But a huge thank you for talking us so articulately through everything, and from post-procedure skincare to LED and where that fits in. It's I think really interesting what you're doing here.
Thank you.
Congratulations on the clinic opening.
Thank you. It was a wonderful conversation. I really enjoyed it.
It was amazing to chat with you. And I hope everyone who has tuned in enjoyed the conversation with Dr Priya Verma. We're here at Art Clinic. We've been discussing the power of post-procedure skincare, talking about the Epicutis range, and also Medilux LED, which just sounds like the most incredible combination. And I'm sure you'll have people queuing up now to come and try it all. But any questions you have on anything that we've discussed or anything that you'd like to hear from Dr Priya, don't hesitate to reach out to us. Thanks, Priya.
Thank you so much.
Nice to be here, and thanks everyone for joining us. We'll see you next time.